Hi everyone, good afternoon. My name is Kristian Salas. I'm a PharmD candidate here at Texas Southern University with the College of Pharmacy. And today I'll be presenting the importance of cybersecurity for healthcare professionals. So as we move towards a fully digitized healthcare landscape, the safety of my patients is now intricately linked to the security of our data. Okay. I just want to acknowledge one of my father figures, Mr. Umesh Verma. He recently passed, but he was one of the actual major influences in my life. He was a cybersecurity firm CEO, and he took me under his wing and taught me all about the industry. And I just want to honor this work and his legacy, and as he's been a big impact on my life. And his 5 Ps were prior preparation prevents poor performance, and I've been living by that almost every day, and it's literally part of my life today. Okay, so my goal is to examine how cybersecurity governance and risk management protects patient safety and maintains the public trust. So I've gathered research across cybersecurity and health management to show that cyber threats aren't just technical burdens. They are core components of clinical risk, and in my thesis, I argue that cybersecurity must be integrated into existing patient safety programs. Just a brief overview. I'll go over what ransomware is, how it affects care delivery, some legal requirements under HIPAA, and we'll also look at how cybercriminals gain access and what organizational priorities we should set to strengthen our practices. So what cybersecurity is? So it's a practice of protecting our networks and data from unauthorized access from the bad people, essentially. And ransomware specifically, it's malicious software that encrypts our data and demands payment for the decryption key. So you're pretty much paying for them to release the information that they stole from you. But remember, in the US, we don't negotiate with terrorists. And criminals target us because they know that in healthcare, downtime is costly and creates immense pressure to restore services quickly to save lives. So research from the University of Minnesota shows that between 2016 and 2021, annual ransomware attacks on healthcare delivery organizations more than doubled, and this resulted in the exposure of 42 million patients' protected health information. So it exposed that information, and most importantly, it taught us that for us as clinicians, over 44% of these attacks disrupted the actual delivery of care. When a breach occurs, it actually has a threefold impact. So first, there's a loss of privacy and the risk of identity theft from the insurance fraud. And second, there can be actual clinical harm. So downtime delays diagnostics and treatments, often forcing ambulances to actually divert their patients to other hospitals, which prolongs time. And finally, these incidents erode the patient's trust, making them less willing to seek care in the future. Okay. So there are also massive financial and legal ways. Healthcare has the highest average data breach of any sector, nearly 10 million per incident. Also HIPAA violations. So just a little bit about HIPAA. So Health Insurance Portability and Accountability Act. It's actually was set in place for businesses as a set of laws where they're required to have some type of legal, I would say, how should I put it? So in a more simple fashion, it's a legal set of laws that sets in stone how an organization should act just in case they get attacked. Okay. So how HIPAA violations alone can result in civil penalties of several $1 million. And we're also seeing a rise in class action lawsuits and even negligence claims against healthcare leaders when inadequate security contributes to patient harm. Okay, to manage this, so as I was going to the HIPAA security rule, the HIPAA security rule is implemented, which requires administrative, physical, and technical safeguards for electronic PHI, which is protected health information. Organizations are required by law to perform risk assessments and notify individuals if a breach is suspected. And now we look to frameworks like the NIST, which is the National Institute of Standards of Technology, cybersecurity framework to provide the standards for compliance. So you might wonder why we are such high value, why the healthcare sector is really of high value. So a medical record contains the full package: diagnosis, medications, identifiers, all in one place. So it can really make you even a vulnerable person in the real world. And this makes us valuable. Let's say, for example, the dark web, they can use our credit card numbers because of the medical history is permanent. So stolen data can be traded and used for fraud even for years after the initial breach. So recently I was actually a victim of this, where my insurance providers is Blue Cross Blue Shield, and their data centers got breached in some, I think it's called a conduit, and my information got exposed, and now I had to log all my credits. And even then, that still doesn't make me safe. I mean, people know where I live, they know my social security number, everything got exposed. So now I have to constantly watch my back. Okay, are my bank accounts, being opened under my name? So just some things to keep in mind as we live in this increasingly digitized world. So how do they get in? It's often through human error as phishing and social engineering. So social engineering would be, they gain your trust, get to know you, and then that's when they attack you and start asking you their questions that they want to know from you. Other common entries include weak passwords, unpatched operating systems. That's why they tell you update your laptop, update your computer. And unsecured remote access for telehealth or VPN, so virtual private networks. Virtual private networks just keep you safe while you're surfing the internet. And then even third-party vendors can be a backdoor into our systems. Like I said, when Blue Cross Blue Shield's systems got attacked. So a 2020 study confirmed that criminals are specifically targeting electronic health records, and their primary targets are email and network servers. So this research helps us map out where the most vulnerable parts are so that we can act accordingly. So here it's just a chart that visualizes the vulnerabilities over a 10-year period. And so you can see a sharp increase in breaches involving email and network servers starting out around 2016. Right here. So in green and then in blue as well. So green would be network servers, and then the blue is the emails. Okay, and then while traditional risks like laptops or paper files still exist, the digital frontiers where most significant growth in threats is occurring. So some key approaches that we can use to battle this is to actually use the NIST Cybersecurity Framework, which is a set of guidelines, standards, and best practices published to help organizations mitigate cybersecurity risks. So their aim is to help organizations prioritize cybersecurity investment and decisions, and to understand their cybersecurity maturity, and to provide a framework for conversations with stakeholders, including senior management and the board of directors within their organizations. So what can we do? So now that we know that we must embed cybersecurity as a patient safety issue, this means that cyber threats are increasing, and we need to have reporting systems that will recognize that there's a threat or a vulnerability in what we have as an organization. So on a practical level, we need board accountability, we need routine risk assessments, and to have, role-specific training for our staff to recognize, for example, phishing is when, I don't know if you've seen sometimes when they send you emails and you think they're important, they're like, hey, you need to act on this now, and then that's when they really get you. And they're like, oh, there's something wrong with your bank info, you log in to see what's happening. Yep, that's how they get your information. And I would say we also have to practice for downtime, so actually running exercises on how to respond to incidents. So on a broader scale, we need to harmonize regulations to reduce burden on providers and expand funding to smaller rural hospitals that may lack resources as well. So strengthening our vendor contracts and sharing incident information across the sector is, I would say, essential to systemic resilience. So in the end, we still have some work to do. We need more empirical studies. So empirical studies, it's just research projects that are derived knowledge from actual, observable, or experimental evidence rather than theory or logic alone. And we also need to understand how emerging technologies like AI can really change our approach and how we manage these risks. Okay. And to conclude, cybersecurity, I would say, is no longer an IT issue where you're handling it on your own. So you actually need your organization to bring up a plan to make it a prerequisite for safe, high quality care. And by coordinating our efforts and framing this pillar, I would say, of patient safety, we can protect our patients and our organizations in this increasingly digitized world. Thank you. And these are my references. And then now for questions. Thank you. Yes, ma'am.
A lot of us have Blue Cross Blue Shield.
Oh, yeah.
We got those letters. But they told us